Today we are going to start chapter 1, Introduction to Dental Anatomy. Dental anatomy is study of development, morphology and function of teeth and identification of each teeth in human dentition. Now formation of dentitions. We have three types of dentition in our lifetime. The first is deciduous or primary dentition or teeth. These are also known as milk teeth, which start developing at the age of 14 week of prenatal life and they completely appear during the age of 3 years. Now the second type of dentition is known as transition or mixed dentition, because here it can be seen at the age of 6 years, around 6 years, like the both permanent teeth or succedious teeth start to appear in the child's mouth along with the deciduous teeth. So that is known as mixed or transition period. Now the third is known as permanent dentition or succedious dentition or adult teeth. Now they occur around 14 to 15 years of age, and the permanent teeth are fixed to the jawbone, um, and molars are also fixed. But the third molar is also known as wisdom teeth, occurs between the age of 18 to 25 years, and in some adults it may be absent. Now let us go to the nomenclature. Here we can see the upper jaw. The upper jaw is also known as maxillary or maxilla, and the lower jaw is also known as the mandible or mandibular. Now classification of dentitions. There are two criteria for classification of dentitions. First is by morphology, that is structure of teeth and appearance of teeth. Like we have homodontic and heterodontic. Homodontic is that having teeth with the same size. All teeth are of same size. But heterodontic have different sizes. Like we have different size for each incisors, canine, molar, premolar, etc. Now the second criteria is by sets of teeth. Mono Monophyodontic, that is only one set of teeth. Diphyodontic, two sets of teeth. Like we have two sets of teeth, that is primary teeth as and permanent teeth. And polyphyodontic, that is they have multiple set of teeth. Now basic formula of mammalian teeth. Here the letters I is represent incisors, and here the letter C represent canine, or they are also known as cuspids, and P represent premolar, M represent molar. Now the formula for primary or deciduous teeth. As we know, the total number of teeth in primary teeth or deciduous teeth is 20. So the formula is like this: incisors 2 by 2. Here we write 2 by 2 because we have two incisors up in the upper jaw or maxilla, and two incisors at the lower jaw or mandible. And C 1 by 1, canine 1 and one in the maxilla and one in the mandible. Molar, two in maxilla, two in mandible. Here you can see the premolars are absent. So the formula is 2102 by 2102 equal to 10. Now formula for secondary or succedious teeth or adult teeth. I 2 by 2, C 1 by 1, P 2 by 2, M 3 by 3 equal to 16. So total number of teeth in a adult human is 32. Now let us go to the tooth numbering system. We have three types of tooth numbering system: Zsigmondy or Palmer numbering system, then universal numbering system, and FDI. First let us start with Zsigmondy or Palmer numbering system. It is represented by symbols of 4 quadrants and letter corresponding to the teeth. Here we will explain it. It is different for primary as well as permanent tooth, because we have a difference of numbers here. The primary dentition Zsigmondic symbolic representation of Zsigmondy or Palmer numbering system. Here you can see we'll take A, B, C, D, E in 4 quadrants and divided by line. This line is also known as mid-sagittal plane, and the incisors beside this line are known as central incisors, and beside central, lateral incisors, then canine, and 2 molars. Because premolars are absent in primary teeth, we don't mention them. Now 4 quadrants, it is of right side and it is left side. Now, alphabet from A to E are used to denote tooth in each quadrant. To represent single tooth, and the quadrant with tooth are expressed as like this. The formula is like this. For example, we'll take this first quadrant D. So we'll say we'll represent it as right maxillary, first quadrant, molar. Which molar it is? First molar. So right maxillary, first quadrant, first molar. Right maxillary, first quadrant, second molar. Here you can see in primary dentition we use alphabets, that is from A to E. And now let us move to permanent dentition. Here we use numbers 1 to 8, and only difference between these primary and permanent representation is we have 2 premolars and 1 molar added, and we use numbers here. Here for example we see this symbol, that is we know this what quadrant it is third quadrant, and second, that is lateral incisors. So we have to represent it like left mandibular lateral incisors, and this is right maxillary first premolar, for canine, right maxillary canine 3. Now second numbering system is universal numbering system. Here in primary dentition, in universally numbering system we use alphabet A to J, and for maxillary teeth we use alphabet A to J, and for mandibular teeth we use K to T. The 4 quadrants are taken in clockwise direction. Here we can see clockwise direction, it starts from right side first quadrant to fourth quadrant, clockwise direction. It is right left, and this is mid sagittal plane, as you know. Now the second universal in numbering system, the permanent dentition, the numbers are used from 1 to 16 for maxillary teeth and 17 to 32 for mandibular teeth. Here you can see it also goes from first quadrant to fourth quadrant in clockwise direction. Now FDI numbering system, it was proposed by Federation Dentitive Internationale. This system is adopted by WHO and others such as International Association of Dental Research. So it is a standard system we use right now. So the first is primary dentition. Here we use numbers like 5, 6, 7, 8, where we add suffix for every number like 5, 6, 7, 8, and the suffix is 1, 2, 3, 4, 5. 5, 1, 5, 2. We have to pronounce this like 5, 1, 5, 2, 5, 3, not 55, 51, not like that. 5, 1, 5, 2, 5, 3, 6, 1, 6, 2, 7, 1, 7, 2, etc. Now if they ask, they'll ask questions like what is 5, 1? So we have to say right maxillary central incisor. Now permanent dentition. Here we use numbers 1, 2, 3, 4, 1, 2, 3, 4, and the suffixes are 1, 2, 3, 4, 5, 6, 7, 8. Till 8 we have to write the suffix. So 1, 1, 1, 2, 2, 1, 2, 3, 3, 1, 3, 2, 4, 1, 4, 2, etc. Here also, for example, if they ask the number 3, 3, 3, then we have to answer left mandibular canine. Now let us go to crown and root. Here we have the 3 structure. The upper part is known as crown, and the lower part, which is embedded inside the gums, is known as root. So the bone which margins the teeth is known as alveolar, and which have sockets. Inside the socket the roots are embedded. Now the first part or hardest part in our body is enamel, and the second part is dentine, and we have pulp inside. Pulp contains all nerves and blood supply. Now here the supporting part, gums or gingiva. Now here we have cemento-enamel junction. Cemento-enamel junction is CJ, where the dentine is called in the crown, where if it goes to root it is called as cementum. So the junction between the enamel and cementum or the root dentine is known as cemento-enamel junction. Now, pulp in crown portion is known as pulp chamber, and pulp in root portion is known as pulp canal. Both together is known as pulp cavity. Enamel, cementum and dentine are hard tissue, whereas pulp is a soft tissue. Root is firmly fixed into jawbone and called as alveolar process. The bone is known as alveolar. Now, crown are of two types, the anatomical crown as well as clinical crown. Now, anatomical is a portion of crown from where the CEJ or cemento-enamel junction to the incisal edge. Incisal edge is a chewing surface or the occlusion surface. The edge of incisor is known as incisal, or anterior teeth is known as incisor, whereas the edge of posterior teeth is known as occlusion, is known as anatomical crown, where it can't be visible. But in clinical crown is a portion where the tooth from the incisal or occlusion to the gingival margin, that is from here to here. So we can see the teeth. The visible part of tooth is known as clinical crown. Now, tooth location. Anterior teeth. Anterior teeth are the teeth which are at front of our mouth, like incisors, canines, which are 12 in total, 6 in each row. Next, posterior teeth. Premolars and molars are known as posterior teeth. Now, surface and ridges of the teeth. Now, crowns of incisors and canines have 4 surfaces and 1 edge, whereas crowns of premolars and molars have 5 surfaces. Now, here you can see the incisors and canines. These are the incisors and canines, which are also known as anterior teeth, which are facing towards the lips. Here we have lips, so they are facing towards the lips, so they are known as labial surfaces. And in premolars and molars, here we have premolars and molars, and they are facing towards the cheek, so they are known as buccal surface. This surface is known as buccal surface, and this anterior surface is known as labial surface. Now, these both buccal as well as labial surfaces together known as facial surfaces. Now we know that the front teeth, the teeth towards the lips or else cheeks, are known as facial teeth. Now if we go back side, these teeth are together facing the tongue, so these teeth are known as lingual surface. This surface is known as lingual surface. It may be posterior teeth or anterior teeth. It is known as lingual surface. Now here we can see the midline or mid-sagittal plane. Here it is present, and teeth away from the midline, which are away, are known as distal teeth or distal surface, and teeth which are near the midline are known as mesial surfaces. The surface near the midline is mesial, and surface away from the midline is mesial. For example, if we take this central incisor, this is the midline, so the surface near this is known as mesial surface. And now this from the midline, this surface is away, so this is known as distal surface. For every tooth we have this surface. For example, for this lateral incisor, this is the mesial surface, and this is a distal surface. Now the area of touching both mesial as well as distal surfaces. For example, here you can see I told you that this is distal surface, and now this is medial surface. This is distal surface of central incisor, and this is the mesial surface of lateral incisor. So these both are touching together, so this area is known as contact area. Now let us know chewing surface of teeth. Incisal edge. This is chewing surface of anterior teeth. Here you can see these are anterior teeth, as we know, incisors, canines. So this surface which we use for chewing is known as incisal edge or incisal ridge. Now occlusion surface. Occlusion surface is a chewing surface where we use for both premolars and molars or posterior teeth, and which have many things like cusp, ridges, grooves, etc. We'll learn about them. Occlusion table is also present in the posterior teeth. The occlusion surface within the cusp and marginal ridges is known as occlusion table. Now let us see the other landmarks. Now here you can see the picture of all teeth. The first teeth is also known as central incisor, the second lateral canine, first premolar, second premolar, first molar, second molar, and third molar. Now as we already learned this, this line is known as medial line or mid sagittal plane. Now the surface is known as labial surface because it is facing towards the lips, and these are anterior teeth. Now this surface is known as buccal surface because they are facing towards the cheek, and they are together known as facial surface. And now this is the lingual surface where teeth are facing towards the tongue. Now away from the midline is known as distal surface, and towards the midline is known as mesial surface. Now let us move to enamel surface elevations. Now the first one is cusp, a large elevation of enamel located on the occlusion surface of all posterior teeth and the incisal edge of canines is known as cusp. Now here we have incisors have no cusp. I'll show you cusp. We have cusps here. These are surfaces like elevated portion like this, which help in chewing of materials. Now then we have tubercle, an extra formation of enamel on the crown of a tooth and often manifests as a supernumerary cusp such as the cusp of cerebelli. Now cingulum, bulbous convexity of enamel located on the cervical third of lingual surface of all anterior teeth. I will show you cingulum. Here you can see the teeth from the inside or lingual surface of teeth is convexly bent inside. Here you can see. So this is the gap here. It is not straight, it is bent. So the bend here is known as cingulum. Mammalion, a round extension of enamel on the incisal edge of all incisors. Usually 3 mammalions are present on each incisor for each facial lobe. Their present in adults is an indication of malocclusion. These are mostly seen in children. So presence of them in adults is also known as malocclusion. These increase the chewing surface area and help in mastification. Now here the curves like this 3 are there. Mostly 3 are present on each incisor. So 3 curves here you can see. These are known as mammalion. Now lobe. The primary center of the enamel formation in a tooth is known as lobe. And in adults, the lobes are represented by cusp, mammalions, and cingula, and are separated by developmental depression or developmental grooves. So lobe is a basic form. The enamel forms from the lobe. So we studied the cusp, tube, cingulum, mammalion. These are all forms of the lobe. Now let us go to the ridges. Ridges are of many types. The first ridge is a linear elevation on the enamel surface is known as ridge. Now we'll see the types of ridge. The first type of ridge is marginal ridge, a ridge on all teeth that forms the mesial and distal margins of posterior occlusal surface and anterior lingual surfaces. Here you can see the marginal ridge. So here we have cingulum, the curve or convex edge, and lining to the cingulum, here lining to the cingulum, this ridge is known as marginal ridge, and it is present in every tooth. It forms here you can see this is mesial and distal surfaces. So we can say it forms mesial and distal surfaces in towards the lingual side of the teeth. Now the second type is labial ridge. It is only seen in canines, and that runs inciso-cervically in the center of the facial crown surface, more prominent in maxillary canines. The cemento-enamel junction is also known as cervical. So inciso-cervically, here the term used. Now buccal ridge. It is only seen in premolars and that runs from occlusocervically in the center of the buccal crown surface, more prominent in first premolars. Then cervical ridge. They are seen in primary teeth and permanent molars that runs mesodistally in the cervical third of the buccal surface of crown. Then oblique ridge, a ridge on all maxillary molars that extends from the mesolingual. We can say palatal, mesolingual, or we can also say palatal because we have palate, not tongue in the maxillary part. So we can say mesopalatal or ML to distobuccal cusps. And see, it separates the mesobuccal and distolingual or distopalatal cusps. Now triangular ridge. It is ridge on all the posterior teeth that extends from the cusp tip to the central groove, and the mesolingual cusp of all maxillary molars have two triangular ridges. Mesolingual, or we can also say this as mesopalatal, because it is a maxillary. They said it is in maxillary molar. So in maxillary part we have palate. So we can say mesopalatal. Now transverse ridge. It is seen in most posterior teeth that runs buccolingually and connects the opposing the buccal and lingual triangular ridges. They are mostly commonly seen in the maxillary premolars and mandibular molars. Now enamel surface junctions. We have two types: line angle and point angle. Line angle is formed by junction of two surfaces, and point angle is formed by the junction of three surfaces. Now here we can see the line angles of anterior teeth, that is incisors as well as canines. Mesolabial, distolabial, mesolingual, distolingual, labioincisal, linguoincisal. I will show you on the model. So for example, we will take mesolabial. Meso means towards the midline. So for this lateral incisors, the mesial surface is this mesolabial. Labial is labial. So labial is facing towards the lip. So we have to go front. So mesolabial. So we got an angle here. Mesolabial. So this is known as line angle. And one more thing we'll take, distolabial. Distolabial is away from the midline. So if this is the mesolabial, this is a distolabial of this lateral incisor. Like terms like mesio means near to the midline, disto means away from midline, labio means towards lip, linguo means towards tongue, and here incisal is known as incisor or incisor chewing surface. Now line angle of the posterior teeth. Posterior teeth means the premolars and molars. Now the buccal is towards the cheek. Occlusal is the chewing surface of the premolars and molars. So mesobuccal, distobuccal, mesolingual, bucco-occlusal, distolingual, meso-occlusal, disto-occlusal, lingo-occlusal, etc. Now point angle. As we know, point angle is the junction between three surfaces. Now point angle of anterior teeth, that is incisor and canine, are mesolabioincisal, distolabioincisal, mesolinguoincisal, distolinguoincisal. Then point angle of posterior teeth, mesobucco-occlusal, distobucco-occlusal, mesolinguo-occlusal, distolinguo-occlusal, etc. Now let us go to enamel surface depressions. The first is sulcus. Sulcus is a V-shaped depression on the occlusal surface of posterior teeth between the two ridges as well as cusps. Now here in this we can see in the third molar, here we can see we have a ridge here, and a ridge as well as cusp, and this here you can see the V shape. This is known as sulcus. Now the second is fossa. It is irregular shaped depression in the enamel surface. Now here you can see fossa also. Here this sulcus is V-shaped and the lining of this sulcus is known as fossa. Now developmental groove is here. Developmental groove. This is known as developmental groove, which develops from the center and extends on the surface also. Developmental groove is a well-defined shallow linear depression in the enamel that separates the cusp lobes and marginal ridges of a tooth. Now here you can see it separates two ridges, two cusps. Now fissure, a narrow fissure is something which is a narrow point-like structure. Here you can see here. So it is a point-like structure from where the developmental groove starts. Pits. Pits are small point-like structures from where the developmental groove starts. Like we have many pits in one tooth. Now supplementary groove or irregular defined short groove auxiliary to the development groove that does not separate major tooth parts but developmental groove separate the tooth parts. Now let us know about embrasures. A triangle is shaped between the proximal surface of the adjacent teeth which diverge in four directions from the contact area like buccal, lingual, occlusal or incisal or cervical or gingival. In the health, this space is completely filled with gingival papilla between the cervical and gingival. The largest occlusal embrasure is between the maxillary canine and the first premolar, and the largest incisal embrasure is between the maxillary lateral incisor and canine. The smallest incisal embrasure is between the mandibular central incisors. Now lingual embrasures are larger than the buccal embrasures except the first molar, which is maxillary. Now interdental spaces, we have two names for this. The first is diastema. A space between two adjacent teeth in an arch is known as diastema. Now second one is furcation, the area of multi-rooted teeth where the root diverge is known as furcation, where we have space. Now division of division of teeth into thirds. The first we have incisor. Here in this incisor we divide the part. The root is divided into apical, middle, cervical, and again in this teeth we divide it into the distal part is which is away from the midline, then middle and mesial part which is near to the midline. Now from the top to bottom it is divided as cervical because it is near the cervical line, cervical or CEJ, then middle, then incisal. Incisal is a chewing surface. Here the second picture shows the sagittal section, or if we sagittal section of incisor. Here it is facing tongue, so it is known as lingual. If it in case of maxillary, it is palatal. Then middle, labial. Labial is towards the lip. Now here we have premolar. The first surface is occlusal, which is a grinding surface, middle, then cervical. And if we see from here, the first surface is distal surface, that is away from midline. This part is away from midline, middle, then mesial, which is near to the midline. Now, and this is the sagittal section of this. Here we have buccal surface, which is facing towards the cheek and the middle, then lingual, which is facing towards the lip. Here lingual is facing towards the tongue. So this is the inside part, and middle. Buccal means it is facing towards the cheek. Now let us know about roots of teeth. Maxillary, the upper jaw. The first incisor have one root, canine have one root, premolars have one root. The first premolar have two roots, the second premolar have one root, The molars, first, second, and third, have 3 roots. The mandibulary teeth, the incisors and canines have 1 root. The first and second premolars have 1 root. First, second, and third molars have 2 roots. Now let us know about proximal surfaces of teeth: triangular, trapezoid, rhomboidal. Here you can see the teeth which are triangular are anterior teeth like incisors and canines. Then trapezoids are all maxillary posterior teeth. Then rhomboidal are all mandibular posterior teeth are seen as rhomboidal. So we have completed the first lesson, Introduction to Dental Anatomy. Thank you.